Good day everyone, I'm Andre, your science nurse for today, and today I'm going to perform and demonstrate the evaluation checklist performing the assessment of the kidney and bladder. But before that, we're going to first introduce ourselves, verify our client's identity, explain to the client what we're going to do, why it's necessary, and how the client can cooperate. And then we're going to explain also that the client's result will be used in the planning of care. And then we're going to instruct the client to void if possible. So sir, I am Andre po, your assigned nurse for the day. And a while ago sir, we're done on our history taking. And now po, we're going to do the assessment. It is necessary because if there is any abnormal findings or deviation from normal findings, we can do a planned treatment right ahead. But before that sir, are you comfortable on your position right now? Okay, sir. Sir, please, kung kaya niyo pumapili ng ihe or if you can void, please void it po. Okay? And then we're going to provide for our client's privacy by drawing the curtain and closing the door in the room. And then we're going to perform hand hygiene and serve for other common infection control procedures. I am now going to do my hand washing. And then we're going to help the client to undress if it is a gown is available. And then we're going to put on gloves if it is indicated. And then we're going to assess the client's abdominal contour where the client is laying down. And we're going to place pillow under his head and under his knee to slightly flex. And then we're going to assess the client's comfort. Sir, are you comfortable on your position? Okay, sir, thank you po. And then we're going to make sure that the client is warm so we can drape the client if it is possible. So we're now going to do the inspection of the abdomen and the flank regions. So with the patient's both supine and sitting position. So we're going to assess for the asymmetry or if there's any presence of swelling. And then we're going to assess also for the color, if there's any presence of bruise or redness. And then we're going to assess also for the flank region in the area of the costovertebral angle, which is located between the lower portion of the 12 rib and the vertebral column. It is lower portion of the 12 rib between the vertebral column. And then we're going to assess for the Grace-Turner sign, which is we're going to assess in the flank areas. And then we're going to assess also for the masses in the lumbar region. And then we're going to assess also for the colon sign, which is we're going to assess the glands around the client's umbilicus. And now we're going to do the auscultation of the client's kidney. Of course, using the stethoscope. We're going to use the diaphragm stethoscope and we're going to make sure that we're going to warm first the diaphragm to prevent any chilling. And then we're going to listen over the client's renal area, which is at the mid-clavicular line, which is here at the mid-clavicular line on the client's abdomen. So mid-clavicular line at the client's abdomen. we're now going to do the palpation of the kidney to the both right and left kidney. We're going to take note for the any presence of masses and tenderness. So we're going to assess for the contour, the size, the tenderness, and lumps. In elderly, the right kidney is slightly lower than the left, and then it may be easier to the left kidney to palpate. So for the right kidney, we're going to assume that the patient is in a supine position. I'm now going to place my hand under the client's right flank and my other hand to the client's abdomen. And then I am going to press my other hand to feel the kidney. And then I am going to ask the client to take a deep breath while doing the procedure. Sir, can you please take a deep breath? Okay, sir. Thank you. You can now relax. And then for the left kidney, it is deeper and mostly it is rarely palpated. The kidney should be but when we do the assessment, the kidney should be feel smooth and non-tender. We're going to ask the client to assume on a sitting position, side lying or supine. And then we're going to use the one hand clenched fist in doing the percussion. So first is we're going to locate the costovertebral angle, and then we're going to palpate for the left kidney first. So I'm now palpating, and then when I locate the costovertebral angle, I'm just going to clench my fist and do the percussion. And same thing for the client's right kidney. So I'm going to palpate first for the costovertebral angle and locate the right kidney, and then clench my fist and do the percussion. We're now going to do the percussion. We're going to percuss at the area over the bladder or 5 cm above the symphysis pubis. We're going to detect the different sounds. So when we percuss towards the base of the bladder or the client bladder. So in doing the percussion, it is normal when we hear a tympanic sound. But when we hear a dull sound, it might indicate a bladder distension. And then if the patient identifies flank pain, we're going to, or tenderness, we're going to percuss first the non-tender flank. So okay, so we're going to locate the symphysis pubis. So here is the symphysis pubis, and then we're going to percuss 5 cm above. So here you go. So based on the procedure that I do, I hear a tympanic sound, which means it is a normal sound. So after the procedure, we're going to perform hand hygiene again or hand washing, and then we're going to document all our findings in the client record, and then we're going to perform a detailed follow-up, examining based on the findings or if there's any deviated from normal findings or expected from normal. We're going to relate findings on the client's recent assessment, and we're going to report to the physician if there's any significant deviation or if there's any deviated from normal findings.